I'm going to start off talking a little bit about why we're here today and why we're specifically focusing on men's mental health. Other than it being Men's Mental Health Awareness Month, kind of why is this a topic of focus for workplaces? So I'll give you some statistical data. One thing I want to say is the statistical data is not very happy at times. Things were getting better kind of pre-COVID and then kind of took a dip during the pandemic again. So a lot of the data that we have is just following up directly after COVID. So I want to keep in mind that things can improve and that they can get better because I think that the statistics paint quite a bleak picture, but actually things were improving prior to the pandemic. So I think we should just keep that in mind before I give you all the bleak statistics that are there. Rachel will also, once people are admitted into the session, Rachel will also be popping in support lines to things like Breathing Space and Samaritans. So if you are struggling after anything that's been said in today's session, there will be those support lines in the chat, and I'll also send them in the follow-up email as well. So I'll start off looking at why are we focusing on men's mental health in Scotland in particular. And I think one of the major things that have come out of research on men's mental health is the high rates of suicide. So 74% of deaths by probable suicide in 2023 were men. The largest age group affected were 25 to 44, followed by 45 to 65, which is particularly pertinent to you as employers and as people in the workplace, because that's largely working age. So I think it's really important to think about kind of the consequences and why it's really important to create spaces where people can speak to each other, can have that peer support, and can kind of be open about their mental health, both in work and outside of work as well. The session is recorded, sorry, I forgot to say that, so please do turn off your cameras if you're uncomfortable being recorded at all. Obviously, you're welcome to have your cameras on if you're fine with that, but just letting you know that that the session is recorded. Out of the probable deaths by suicide, the occupations that are most affected by this are skilled trade occupations and elementary occupations. This includes things like farming, construction, factory work as well. And a lot of the industries that are coming up for highest numbers of suicide by occupation are traditionally male-dominated industries, which again is why we're focusing on men's mental health in the workplace today. No, I will send the full kind of description of those trades as well, but I think we'll look at specifically at like construction today as well, and kind of from Mates in Mind, and have them speak a bit about what they're doing within that field. But yeah, it's largely within male-dominated fields that there is those higher rates of suicide. And there's social isolation as well. So Public Health Scotland said that men are less likely to report high levels of social support or frequent social contact. So there's more loneliness. And when I was looking at the data on this topic, actually men and women's mental health kind of has taken a similar dip of COVID, but the difference is that women are more likely to reach out for support from friends or family rather than have this isolation, whereas men are more likely to have levels of social isolation, and that's kind of where the concern is, that where is that support to open up and have these conversations. And there was also an increase in number of men who've self-harmed in 2021 compared to 2018 and 2019. So that was from the Scottish Health Survey as well. So this is why we're focusing on men's mental health, and why it is really important for employers to be aware of their staff, of their mental health, and kind of create spaces to have open conversations, remove that stigma around talking about mental health, particularly at work, and particularly where there is maybe more male-dominated fields, create those spaces for those conversations. So I think it's really important to have that as an area of focus today. The Scottish Mental Health Illness Stigma Study also covers a lot of data around about the stigma that people feel. It is worth noting that only 97 of the participants in this study were male, however, out of 346. However, the kind of data still stands that participants felt like they'd been untreated at work because of their mental health. They'd stopped themselves discussing their mental health at work. 75% said they'd stopped themselves from discussing their mental health at work. And 65% had stopped themselves from taking leave entitlements such as annual leave and sick leave due to stigma about their mental illness. And 43% feared being moved on from their position or passed over for promotion due to their mental health and stigma around that. So it is really affecting people's perceptions of themselves at work and thinking, oh, if I talk about my mental health at work, if I speak about my needs and kind of reach out, what will happen? Will I be passed up for promotion? Will it affect my performance at work? And really thinking about, especially for people that line manage, having those conversations, having that reassurance for people that actually mental health should be treated the same as physical health, and really having conversations with your employers that it's fine to speak about this and actually it's needed to speak about this in a lot of cases. So touching on the stigma, mental health stigma amongst men remains a really high barrier when engaging with mental health services. So not only are they less likely to reach out to friends and family, but also reaching out to mental health services. I think only around about 30% of people that access CBT through the NHS identify as male. And this has been associated for a wide variety of reasons, including kind of masculinity and pride and the image that you need to be self-reliant, which of course it's not the case. No one needs to be self-reliant, but there is that perception there. And then research undertaken by the Men's Mental Health Forum found that over a third of men wait 2 or more years before disclosing a mental health problem, and men were found to be too embarrassed to take time off for work for mental illness, but did not feel this way about physical illness. So this study reported that if, for example, you have a cold or you have an injury, then people were quite comfortable taking time off, but that was not the case for mental health. And actually, why is that? There needs to be more of a conversation about treating mental health on the same field as physical health, and really kind of breaking down that perception that you shouldn't take time off for mental health or you shouldn't discuss mental health at work because it can be really damaging for people. Just briefly before we move on to kind of the guest speakers for today's session as well, I wanted to touch on intersectional stigma because I think it is something that is not commonly spoken about, and that is thinking about your workforce and kind of the different factors that may be affecting them, and that the different factors that may stop people coming forward to disclose mental health and mental illness. So evidence shows that men who are from Black or ethnic minority backgrounds are less likely to access mental health support services, and the Race Equality Foundation stated that cultural expectations to deal with it or be strong affected how mental illness was understood amongst people from Black and ethnic minority backgrounds. So actually it may be even more difficult to access support or disclose mental health concerns in the workplace, and thinking about what approach do you take and is it accessible for everyone? So is your mental health support services and is the conversation that you're having around about mental health accessible for everyone in your workplace? And then lastly, statistical data obtained by Phoenix in partnership with NHS Lothian showed that there was really high level of suicide amongst Polish men in Scotland, nearly twice as high amongst Scots. And the consequence of this was around that shame or fear or discomfort surrounding acknowledging mental health problems as well. So in general, men do not disclose mental health as often as their female counterparts within the workplace, but there's also other cultural factors that can contribute to that. So when you are having conversations around about mental health in your workplace and really trying to break down that stigma, think about, are you engaging with everyone at your workplace, and are you asking them what works for you, what would make you feel comfortable talking about your mental health, and kind of what do you need as an employee to feel comfortable speaking about this in the same way that people would speak about their physical health, because they should be treated the same within the workplace. I won't touch on this too much, but we do have our See Me in Work programme. So if you are interested in learning more about how to tackle stigma within the workplace, we focus on these 7 building blocks, which are senior leadership commitment, creating conditions for safe disclosure, mental health awareness and literacy, mental health training, confident and informed line management, effective implementation of reasonable adjustments, and stigma-free organisation culture and ethos. So that's what our programme is based around, and we support employers to really review their practices, get feedback from staff, and to work on mental health stigma through campaigns and through their services, to try and tackle some of that stigma using these 7 building blocks as a framework for that. This is based on our 20 years experience of working on stigma and discrimination, working on mental health stigma and discrimination, and working with over 100 employers across Scotland throughout those 20 years to think about what works for them and what contributes to a workplace where you can speak about mental health and kind of tackle some of that stigma. So if you are interested, we've got our See Me in Work programme. Again, I'll send these slides out so you can access the links to those, or you can contact me directly as well. So my email is on there of bryony.mole@smescotland.org. So if you are interested in this programme of work and getting involved, it is free as well, so we don't charge for anything, then please do get in touch with me. So yeah, that is a very whirlwind overview of stigma and men's mental health in Scotland. However, I will pass on to our speakers. So our first speakers are Fer and Douglas from SMiW, who are going to speak about the Changing Room project and kind of how that's contribute to an environment where people can speak about their mental health and tackle some of that stigma. I've got the slides up here, so yeah, please do just tell me when to move on and I will navigate the slides from there.
Great, thank you, Bryony. Firstly, it's really good to be with you this morning, and we're really happy to be able to talk about the Changing Room from SMiW. So just briefly, the Changing Room is a mental health programme, and we'll talk a bit more about that today, but it's really just worth saying that stigma plays such a key role within the Changing Room, especially in terms of like the experiences from the men that come to the fore. So although it's a mental health programme, it's also kind of a stigma programme, because when you're getting guys together to talk about mental health, that is one way that we like to tackle stigma. So we'll talk through the Changing Room, and we'll talk through some of the experiences that guys have had within the programme, and maybe just think about how we create a safe space for guys to talk. So Bryony, if you could move to the next slide. Okay, so yeah, go back one just please. Very quickly, I'll introduce myself. I'm Fer Nicholson. I'm the programme manager for the Changing Room. So I've been here since about 2017. I joined SMiW, and in that time I have worked on the Changing Room. So I've helped with the design, the delivery and the development of the programme, which started as a pilot at Hibs and is now nationwide, working with football clubs around the country. And I'll just at this point invite my colleague Dougie to introduce himself.
Yeah, hello, thanks Fer. I'm Dougie, and yeah, I got involved at the pilot stage. After lots of years in financial services, I decided to do something else. I was volunteering, happened to find this project that addressed an audience that I know, men that self-medicate and don't look after themselves and go to football. So I found a brilliant project, and I've been involved for 5 years.
Great, thanks. Okay, next slide, please. So I'll just give you a very brief overview of the Changing Room and kind of Extra Time, which is another programme that we have. So the Changing Room is our core 12-week mental health literacy programme. So it has been funded by Movember since 2017, and so that is why specifically we've worked with men over the years, because we're funded by a men's health charity who were keen that we tackle mental health using the power of football. So we're able to talk about mental health within the football environment, different football stadiums around the country. We bring guys together to share over football, but also over mental health. So it's a 12-week mental health literacy programme, and by that what we're meaning is that we're effectively encouraging guys to come together to get a better understanding and knowledge of mental health in order that they can essentially better manage their own mental health and well-being. That then leads us on to Extra Time. Sorry, just go back, there we are. Extra Time is an additional programme that we have that follows the core Changing Room programme. So it's funded by the Scottish Government and works with kind of 4 of the bigger clubs around the country, so like Hearts, Hibs, Aberdeen and Rangers. And that program allows us to go a bit deeper into certain aspects of mental health. And what happened was that during the initial 12-week program that we have, certain themes that were relevant for men started to be identified, and we thought, okay, we need to do a bit more here. So things like purpose, identity, emotional control, resilience, and confidence. We look deeper into those subject areas with the guys as part of the extra time program, and we're trying to give them tools and resources that allow them to manage their mental health better. And then just a word on the evaluation and future. We've evaluated really strongly. We know that our program has an impact, especially in tackling stigma. And so we're now looking at different audiences that we want to work with. So young men, rural communities. And it's worth saying that we have done some change room activities with women as well. So, we're not totally limited to one gender. So, Brian, if you can move us on. Yeah, so just very briefly, we feel during the change room, what comes up often is that men have experienced of stigma and discrimination, and they know what that feels like, and they know how it has affected them and maybe held them back. But they maybe have a hard time when it comes to actually talking about it and describing it. So we always like to give the definitions that we use, and we find that a really helpful way of equipping guys to better understand their experiences of stigma and discrimination. So just as we go forward in this, stigma is a negative attitudes or beliefs based on a preconception, misunderstanding, or fear of mental health. And very often it's that fear that plays such a key role in stopping people from chatting about mental health and seeking help. And then discrimination is when a person performs an action, whether intentional or unintentional, that creates barriers and inequality for people with lived experience of mental health problems. And very often, the guys that come into the program, they stigmatize themselves and they also kind of discriminate against themselves. And we unpack that and we explore that with them. So you can move us on to the next slide. And Dougie will take from here.
Thanks, Fer. So what I'm going to do is the four sections in colour in the middle are the four phases of our 12-week programme. So what I'm going to do is work through those, not give you lots of detail, but tell you what we're trying to do in each of those phases, but at the same time then talk about how we see our experience of stigma and the participants' experience of stigma and how it affects them and what we're trying to do with it. So signing up actually is quite a challenge because people's experience is the past, it's their family, it's their friends, and it's a stigma that comes with that because they've tried to talk to someone and been shunned or talked away. People are scared to talk to them because they don't know what to say, which is quite a common thing. So their friends back off and they kind of begin to isolate themselves. And because of the way mental health illnesses kind of manifest themselves, people start doubting their worth. So they've got a low self-worth and don't really challenge that and don't feel worthy. So it's a challenge to get them in. So what we do is build up lots of relationships with local public health partnerships and community link workers and the likes to make sure we can get people. And what we find, I think Fer would agree, is once we manage to get people into the changing room, they'll stay, they'll come along and talk because they find as we go on that it is a safe place to talk and feel safe about things. So that takes us on to the first phase, trust. So we deliberately spend 3 weeks out of the 12 making sure we've built up trust with the guys. We'll do very simple things, quizzes, a stadium tour where we can, depends on the venue we're at, which some people find a bit odd, but it's all about the guys spending time with each other, building up trust, using football as a means to get them talking. That's their icebreaker, as it were. And what we'll find on the way through this is that there's a real lack of trust because of their previous experiences. We slot some mental health questions into our quiz in the second week, and find that it does resonate with them, that they've taken years to tell anybody about this, or they've tried and they've been pushed away. So, and there's also the kind of social and the kind of media stigma that comes along with. There's so many crimes reported and it gets blamed on somebody's mental health, which is really, it makes the guys really doubt themselves. One particular individual who came along, and he suffers quite severely from schizophrenia, but he decided he couldn't operate in society because of the way society viewed him, until he managed to get himself along and then start to. We're not tackling his schizophrenia, but we've helped him reintroduce himself to society and move himself on, which is our key thing. I think FAIR refers to the extra time course, but what we ultimately want to do is help the guys help themselves to become self-reliant or reliant on each other and not us, so that they're not coming back to us to manage themselves. They're self-sufficient, or at least they're helping each other as well. So once we get through that trust phase, and do stop me if I'm going on too quickly here, Bryony. What we hope to have done is built a connection. So we'll start at that point. We'll for the first time, and what we'll look to do, as you can see in the little image, we'll try and get them to walk around pitch side at the stadium. And if they're a fan of that club, it's a big thing for them, because they're not allowed to do that normally. You get arrested if you go pitch side. So in that different change of environment, and we'll invite them to do a shoulder-to-shoulder walk and actually give them permission to talk to each other, it's a really powerful session, because at that point, you're not sure whether they're going to chat to each other about how they feel, but suddenly they do, and it's great. It's so uplifting to see them come back in and say, "Oh, well, we were chatting about all sorts of stuff." So it's a good connecting point and starting the conversation, as we call it. And it helps them find their voice and realise that voice in their head saying you're alone is not true. There's lots of other people like you, and quickly they move on to start sharing more with each other. That's not true for everyone. There's some people, when they arrive, they're in a different stage of their mental health journey and their journey to recovery. And some people are much more open to talk, and other people are much more reserved and hold back for a while. But what we do with them is encourage them to keep coming, and gradually you'll find that they will join in the conversation more openly. So at this point, the stigma, it's similar to the trust phase. It's more like they've lost trust with other people. And so what we do, we're very deliberate. Each week we'll repeat our operating principles about being a safe space, not having any judgment in this room, and challenge any judgment that comes along, to make sure that people are being absolutely open and honest with each other, but keeping it within the room, and there's no carrying on the chat away. And gradually they let their guard down. There's a great quote from one of our past participants whose case studies on the SMiW website, where he said he forgot to keep his guard up, which is what the guys practice. It's what I'll hide all this, as you're saying, because of their self-worth and the stigma that they've experienced. So gradually as we go on, we'll make it signpost as we go as well. So at the halfway point, we'll tell them we're there, and then we start to move into this phase that we call learning. And the main session we have after the half time really looks to try and challenge the guys on their perception of themselves and their ability to recover. You hear all sorts of stories about general practitioners. I don't blame them, but it's like, well, here's some medication, off you go. You're kind of stuck with this depression now. And what we're challenging the guys, and we're deliberately prompt quite a debate in the session about, well, can I get better? Can I make myself get better? And how can I do it? And throughout the 12 weeks, we underpin this with a simplistic theory called the 5 ways to better mental health, which is about connecting with people, about getting some exercise, about learning different things, and all different simple things, but we'll keep pushing that home to them to say, you can challenge yourself, you can do these things differently, and that way help yourself. So by virtue of doing that, we're kind of building up their knowledge and their understanding of their mental health and how they can get better. And you begin to see people talking about, I've stigmatized myself. I've been defined by my illness. I'm Mikey the schizophrenic. I'm Mick the gambler. I'm whatever. And it's great to see them start to challenge that and say, actually, I can do things differently here. And one one of the next session after the main learning one, we used quite a video of a Marmite football figure, shall I say. There's people love or hate him, but actually he speaks so well that the guys in every environment say, actually, I have much more respect for that character now. Before, I might have seen him as a bit of a hate figure because he played for them, not us, and he was a tough guy, midfield player, whatever. And then they see that in themselves. They think, oh, I have judged people before. I've judged him or that person, and maybe I'm guilty of this as well. So they begin to challenge their own behaviour too, which is driven home as we get into the developed stage, because we do have a specific session dedicated to stigma and discrimination. And in that, we'll throw up figures that are commonly stigmatized in society and challenge the people to say, well, what do you think of this? Which for me brings up some really great debates in the room about how people actually are still guilty of stigma. They feel that they've been stigmatized, but they'll do it themselves. So it's a really great session to challenge their thinking as well about their own behaviour. A couple of examples perhaps of, I might use an image of kind of homeless people begging in the street, and people always be, oh yeah, but they do that through choice. But in the session that I recall vividly, there was a voice from the far end of the room that said, well, I've been homeless twice and I didn't choose it either time, which led to a great conversation in that group and a huge bit of learning. So I think it's great that they then become really aware of their own behaviour, and we'll encourage them to go away and quietly challenge whatever they see and not ignore it, and not judge people as they might have done in the past. So that's a bit of a whiz through, but that's our course. And what we aim to do at the end of it is, towards the end, we've got a session where, again, using football, we're trying to, well, not try to, we do encourage them to create their own well-being team, so that this is, well, what are all the things you've learned from each other, from coming here, from all your different experiences, and what can you draw on going forward to take away as a kind of self-care action plan, but all dressed up in a kind of football jargon way, which is brilliant. Some of the guys still use them. You encounter folks saying, I've still got that stuck to my fridge, and it reminds me to go out and do things, to be active about looking after my mental health, and not just, well, slip back into that dark hole that I used to be in. I'll actively challenge myself when I feel this coming on. And as we get to the post, what we'll find is it really helps their confidence. The guys will then, a lot of them will move on, or some of them have changed jobs, they've begun work, or they've begun volunteering. They'll bring people back to us to say, well, I've got a friend, can he come? So, yeah, they can definitely come. So they begin to challenge the whole society around mental health, self-worth, stigma, and they stop limiting themselves. We believe that, and we've got great, as Fair said, there's great post-course evaluation about people's social connection and how they feel about their well-being. And as I said earlier on, we're keen to try and help them say, we're here, you can come back and ask us things, but don't be dependent on us. Go forward and look after yourself and can look out there. Yeah, thanks. I'll just stop for a breath.
Thanks, Dougie. Yeah, I think just to kind of summarise as well, in terms of the environment that we try to create for the change room, you can see from that kind of process that we're talking through just how important trust and connections are, and building up those trust and connections for men, because initially they're coming into the programme from a place of, I'm not sure about this and I don't really want to talk about my mental health, but I feel I maybe have to a point of post-programme they're empowered and confident to go and tell their story. And we've had countless examples of guys that have maybe never talked to anyone about their mental health, then going on to share their story. And that, again, just feeds into tackling stigma. One of the things Dougie mentioned there was that we have a session that focuses specifically on stigma, and so the slide that you're looking at here, quite a lot of words on it, but that is one of the slides that we use within the change room within that stigma session. And so the point of it is just to provide the guys with a bit of knowledge around what mental health stigma looks like. And so we'll just very briefly, I'll work through this and maybe highlight a couple of examples. So firstly, we know that stigma around mental health can be a lack of knowledge and understanding around mental health. And actually, that is probably the key central point. You know, it always comes back to all the other things that we discussed, the negative attitudes, language, behaviors, discrimination, lack of resources. It almost always comes back to people having a lack of knowledge and understanding. So what we're trying to do is increase that knowledge and understanding about mental health that people have within the change room, but across society too, that allows people to respond better to challenges. A couple of examples from the changing room. So when we do this slide, it provides opportunities for guys to share their own experiences. So some of the negative attitudes, language and behaviors that people have experienced are really profound. One guy that was on our first changing room course at Hibs, he actually talked about in his work life, he's been off twice with kind of longer term sick. Once was because he had a hip replacement, and the other time was because of his mental health being in a poor place. And he always talks about how when he came back to work after his hip replacement, everyone came up to him and said, "Oh, how are you getting on? How's your hip?" And they were very direct in speaking to him about it. When he came back after his time off from poor mental health, nobody said a word to him. And that was him experiencing the stigma from other people of actually not feeling they could talk about mental health, not wanting to upset him, or feeling able to say something for fear of saying the wrong thing. That negative behavior, that's a result of mental health stigma. People with mental health problems are often seen as an illness rather than an individual, thus devaluing their sense of self. So we've had loads of examples of guys, and one in particular who went to the doctor, received a diagnosis of depression, and it was put to him in such a way that that was who he was. And so everything he saw about himself was through that lens of his diagnosis. And by being in the changing room and being supported by other guys, he eventually came to see that actually, no, my depression is maybe a part of me at the moment. It's something I'm going through, but it's not the whole thing. And then discrimination, unfair treatment of people. This is particularly relevant to the workplace, and very often we've had guys talk about their experience of workplace stigma and discrimination. But the good thing about the change room is guys feel equipped and enabled to actually support one another and share their experience, and that helps them make decisions that are ultimately going to help them move past and beyond the stigma that they experience. And again, just very briefly, stigma around mental health can be lack of resources and unequitable funding. So that is something that we know all about. We, as a charity and as a programme, we need funding every few years. So we're very much aware of the challenges that come with that. I'll move us on, Bryony, if that's okay. We just want to talk about the impact very briefly. We've, in the kind of past 7 years of this programme, we've had over 700 participants come through our course. And that's really significant for us, because for every guy that comes through it, it's not just them that's impacted, it's actually their families, their friends, their workplaces. That all goes a long way to tackling the impact of stigma and more people being more confident. We've got a very brief quote there. So this is one guy that was on our course at Rangers. "It's helping me to get into a more positive way of thinking, changing from I can't to I can't right now, but maybe I can in the future. That's important, or you'll stay stagnant. I know I'll have ups and downs, but it's all about positivity. I've done it before. I'm strong enough." That is a great quote. I love that one. It really represents a shift in someone's thinking and attitudes towards mental health. Brian, if you want to move on, I think Dougie's got the next slide covered.
Once I've unmuted my mic. Yeah, thanks, Fair. Again, this is a quote from a participant, and what he said was one of the things that's so important about the change room is that it helps get past the stigma, because men are reluctant to talk about how they feel, but by putting them in the stadium where they've already got an attachment, as I said earlier, it lowers their guard. It's because they love the football and their team. I mean, people talk about football, they're already emotionally engaged. and it makes it easier to open up about how you feel because you're already there. And that was from the fellow that's got a case study on the SMiW website, and talked about how he let his guard down because he felt at home in a sense. So yeah, thanks.
Thank you so much. Is there anything else you'd like to add, or?
No, that's
No,
it. Thanks for
conscious of your
listening.
time, we could probably give you lots of more examples.
Thank you so much. Thank you. It was really useful, and I think the main message that the employers should be able to take away from that, as well as signposting to this amazing support, is also making mental health conversations relevant to the people that are in your workplace. So find things that they like, find things that connect people, and really build on those conversations and those connections within the workplace when you are having conversations about mental health. So maybe make it initially about football, but then lead it on to more conversations about mental health or other things that connect people. If you've got other groups or hobbies that people are involved in, so I think it's definitely good to have that community and really encourage that for people. So thank you so much. Yes, Douglas.
Just picking on that, the point you said about use something else. We did try to do, or we did run a changing room course with male Syrian people who've been rehomed here. And initially we were told they had a big interest in football, but we found quite quickly that they had zero interest in football at all. But what we did find is they had a much bigger interest in history and culture and actually food and things like that. So we're able to use that as the means to get them talking. So yeah, you're right, you're spot on about, just use something else. Find what it is that is the common thread and then build up from there. Right, I'll be quiet now.
Thank you so much. Thank you so much. I think it's really important that when we're in workplaces, we're thinking about the connections and how we can build those safe spaces for people to chat, as well as direct them to other places as well. We'll now hear from Lindsay from Mates in Mind, who will speak a little bit about the work that they're doing in the construction industry to create those spaces for people to talk about mental health. I touched on earlier about particularly high rates of suicide within the construction industry and how important this work is. So I'll pass on to Lindsay. And again, Lindsay, I've got your slides, so just tell me when to move on.
Thank you so much. So my name's Lindsay. I'm a support manager at Mates in Mind. So our charity was founded in 2017 as part of the British Safety Council, and we came kind of in response to the Farmers Report. So the Farmers Report found that we were losing on average 2 construction workers a day to suicide across the UK. So following this report, a lot of organisations started putting mental health procedures in place for their staff, but often these were all tertiary measures. So by this, I mean they were measures that would only be effective when someone is already in a state of crisis. So Mates in Mind like to take a preventative stance and look at how we can get the conversation started and get people talking about their mental health after they've had one bad day at work, rather than waiting until they've had a year of bad days and they're already struggling to cope. So we work with organisations to implement a holistic approach to create permanent change to the culture that is so embedded in the construction industry and the related sectors. If you can just go to the next slide. So here's some further statistics. So the HSE found that in 21 and 22, stress, depression and anxiety accounted for 51% of all work-related ill health cases and 55% of all working days lost due to work-related ill health. In 2021, there were 5,219 registered suicides, of which 74% were men. And in our own research, we found almost half of construction workers find it hard to talk about their mental health, and over 2/3 believe there's a stigma that stops them from talking about their own mental health struggles. All of these statistics reiterate that there is a big problem within the industry, and we just cannot afford to keep losing 2 construction workers a day to suicide, because these people are our friends, our families, our colleagues. They're people that we all care about, and we cannot just ignore this statistic. I always say it would be so much different if we were losing 2 hands a day to a circle saw. The industry would be on meltdown, and no one would be able to use that saw until we found out the root of the problem. Yet, because we're losing 2 construction workers to mental health, it's just being ignored. So the only way we're ever really going to make a difference is if we all appreciate that we all have a part to play. And if we can change the way that we think, feel and talk about mental health, we have a power to create a ripple effect through our entire workforce. Just go to the next slide. So since 2017, we've worked with over 700 organisations within the industry, and through this we have reached over 700,000 employees all across the UK. This includes working with some of the biggest in the business, such as Balfour Beatty, Mace, Tideaway, but we also like to focus on the kind of single man in a van businesses, as we appreciate sometimes it's these self-employed individuals that are the most vulnerable because they have the stress of chasing down payments, they have the isolation with no colleague support, they have the anxiety about where the next job's coming from. So we really try to make our work and tailor our approach to everyone within the industry, no matter how big or small the organisation. So we travel all around the country talking at corporate events, as well as running training sessions aimed at raising awareness of the statistics, the factors that are contributing to why these statistics are so high, and also building confidence in others to spot the signs of when their colleagues may be struggling. In 2023, we launched our BM8 text service in partnership with Shout. So this is very much just the text version of the Samaritans. We appreciate a lot of construction guys are on site. They don't have the space or the confidentiality to kind of be able to go into a private room and hold a phone call. And a lot of them don't want to because of that anxiety of picking up the phone and speaking to someone they don't know about their mental health. Yet the BM8 text service, it allows people to talk while they're in the bathroom stalls, while they're still on shift, while they're in their hotel rooms, while they're working away. It's a lot more of an accessible platform for them, and we found it to be extremely useful. We've also started going into related sectors as well. So we're now going into transport and logistics, farming and agriculture and manufacturing, because we are seeing kind of replicated stresses and pressures across all of these. And like Briley said earlier, it does tend to be these male-dominated sectors that have these similarities. We just go to the next slide. So as I mentioned, there are specific stressors that arise in the industry that are contributing to high suicide rates. So from the outside looking in, I think the men often get told things like, you know, you just sit in the sun all day and put bricks together. You know, what have you got to be stressed about? When it rains, you get to go home early. Like, I wish I could work in this industry. I think it's very misunderstood from the outside looking in. The misconception that the industry is all plain sailing is really far away from the reality that I've seen. So construction deadlines are a massive one because they usually kind of get told we've got a 12-month project and we need it to be completed in 6 months. And because different organisations are trying to win the contract, they'll often take on way more than they can actually do in reality. And as a result of this, they then require long hours, getting subcontractors in that don't even live in the area. So that means they're working away for a long period of time. They don't have the usual support systems around them, and they're usually getting up at 3-4 a.m. in the morning and working outside in the lovely British weather. So they're outside in the cold, they're outside in the rain, and it is generally working out into the late. They kind of don't almost see, they don't have any of their social time while it is actually light outside. Which for their mental health is a shocking effect. They're having to work in dusty conditions, loud conditions, in very not nice parts of the city as well. They're normally in the middle of nowhere, and they're running against the clock every single morning. The banter on sites is a massive one as well. It's perpetuating stereotypes around male mental health. I've had the privilege of going onto sites and hearing beautiful things such as, "Don't cry, we're still on the clock," and "We haven't got time to sit around and talk about feelings." And because of this, people don't feel safe to talk about their mental health in this industry, and that's the issue. Even managers, project managers are so under pressure themselves. Firstly, they aren't recognising their own mental health and the impact that's having on them, but they're also not allowing the space or room to consider the mental health of their team. Just go on to the next slide. So the CIOB conducted research into mental health provisions and what organisations have in place. So we look at the bottom, which is the tertiary measures, which I mentioned. And even the bottom line of having someone in crisis, only 35% of organisations have mental health first aiders. So someone that actually has a suitable training to talk to the colleagues that are in distress. Which is often meaning that a lot of people are going into distress at work and none of their colleagues kind of know what to do, know how to handle that situation. They're panicking, and that is putting that one person under further distress as they aren't receiving the support that they need. I also ask organisations as well, kind of what support are you putting in place for your mental health first aiders? because it's only a 2-day course. You do a 2-day course, and now all of a sudden you've got people coming to you, people you know, people you care about, saying, I'm struggling, I'm having suicidal thoughts. And now that person's then got to go home and carry on with their day and not let that weigh on them. So many organisations aren't putting the support in place for their mental health first aiders either. 71% of organisations also aren't having any mental health training. So when we look at prevention at employee level, no one is training the staff on kind of how do you speak about mental health? How do you approach a colleague if you're concerned about mental health? If someone does come to you and open up, are you confident in having that conversation? A lot of the time it's not even mentioned in the induction phase of a training company, which it really shocks me, because even when I worked in an office, I had to do so much physical safety training. Even though I was not in construction industry at all, I still had to know every single fire extinguisher and how to use them. Yet mental health, which is specifically high in this industry, there's still no mention of it when onboarding. And finally, only 56% have a mental health policy. So in other organisations that don't have a mental health policy, if someone does come forward and say they're struggling, the organisation doesn't have anything formal in place. And in a loose way of saying it, they're kind of winging it. And this highlights that none of these areas are really being met, whether it's addressing the source of the problem, those stresses that I've just mentioned, building the confidence in peer-to-peer support, again, it's not really there. And then the treatment, even kind of the bare minimum you would expect an organisation to have, still they're kind of failing to put that into place for them. We just go on to the next slide. So this is where we step in. So Mates in Mind works with organisations on a one-to-one basis, and we look and put into place a holistic approach so it becomes their company norms. We really try to look at every single angle that we can possibly see could improve employee support. First, we look at the culture. So what are everyone's general thoughts and feelings about mental health in the workplace? Are managers caring about the reasons why staff aren't meeting their deadlines, or are they just angry about the fact it hasn't been met? Are the lads on site still saying, I don't have mental health doesn't exist? Because we can work with them to change that. We look at policies and procedures. Are you completing your stress risk assessments? Even though this is a legal obligation, almost half of organisations we speak to do not know what even a risk stress assessment looks like. Using your return to work interviews as well are a massive thing. After sickness, it can be a great way to understand your employees better and put provisions in place to support their mental health when they're returning to work. Yet so many organisations still use these interviews as a way to shame employees for taking the time off in the first place. Training and awareness, it is vital to be providing managers, especially with that training. So again, if that employee comes to you and says they're struggling, being able to have the confidence to know how to handle that conversation, because it could have took that person months of building up to being able to share what they're going through. And if they have a bad experience and you knock them down, it can put them kind of back 10 steps, and it can make them not want to reach out for help again. So we really do try to provide people with the confidence to be able to hold that conversation. We don't expect you to be doctors or counsellors, but being able to hold that conversation, signpost them to the necessary support, and you can then go away as well knowing that you handled it in the best way possible. Because sometimes when you have that conversation with someone and worry you've said the wrong thing, that then plays on your mind and it can impact your mental health. So we really do just try to support everyone in this conversation. We know it's going to be happening because the suicide rates are so high. So we know that these conversations need to take place, but we just want to give you the skills on how to do it. Leadership practices is a massive one as well. Do you have the buy-in from senior management? Do they talk about kind of staff well-being in their monthly meetings? And are they identifying the specific stresses are happening on each of their projects? And are they explaining to staff how they're going to intervene? Just go to the next slide. So as I said, we know that so many more people are likely to go to a partner, a friend, a colleague, a manager before they ever reach out to professional support. It's very much just step one of probably their healing process, but it is a really important step because it is the first one. Like I said, just being able to refer on to these services can be vital and can be life-saving. So being able to know where you can go for support, knowing what hotlines are available, knowing what your GP support is in the area, I know that NHS are working on making it so you can self-refer to talking therapy and not having to go through your GP, because it is becoming so hard to get that doctor's appointment. So again, as a manager, as someone that has a team beneath them, knowing and understanding what's available in your area can be a really, really useful tool to having that conversation. There's an app called the Hub of Hope, which again, you can put your postcode into the app and it can bring up your local services again. So having this on your phone again is a great idea. Let's just go on to the next slide. So this is very much what we do. That's very much just a screenshot and a quick run through. And this is my email. So if anyone was interested in getting further information, or you know someone that is in the industry that is struggling with their mental health, please do just make a note of my email and feel free to reach out at any time. And yeah, thank you very much for inviting me to speak today. I do really appreciate it. And yeah, looking forward to hearing the rest of the day.
Thanks so much, Lindsay. I think so much of that advice is accessible across different employers, no matter what environment you're in, around about having policies, having support mechanisms, having training. So I think that was really, really useful. So thank you so much for that. Just very briefly, because we're slightly over, I'll just quickly hear from Dan around about Dan Henderson from your work with RMT, around about the work that you've been doing with apprentices, and some of that good practice of how you can create safe spaces for employers, for employees to kind of have more connections and speak about your mental health and make them feel comfortable in the workplace. We'll just have just under 10 minutes, so if you can chat a little bit about what you've been doing, especially with your apprentices. I know we've spoke about that, and it was a really good example of what employers can do.
Okay, thank you. Thanks, Bryony. And thanks to SMiW. Thanks for the invite to take part today. We've been involved, I'm through RMT and CalMac Ferries, we've been involved with SMiW, the employer support group for a number of years. Something we'd also done previously, pre-COVID, was the SMiW Work Survey, which was something that was a massive success. I think kind of surveys in the maritime industry, I don't know how it is in other industries, usually about 15-20% survey returns is quite high. We achieved 52-53% on the SMiW Work Survey, which for us was phenomenal. So we've got a good strong relationship with SMiW going back a number of years. So I don't have any slides, any presentations. I'm just going to have a wee blather and take you on a wee kind of journey through what it is that we do. My name's Dan Henderson. I'm a merchant seafarer. I worked at sea for 33 years as a ship's cook. I'm currently on full-time release with RMT, as you can see there, National Union of Maritime Transport, Rail Maritime Transport Workers. And for the last 14 years, I have been on full-time release with CalMac Ferries, working as a union learning organiser. Union learning is something through Scottish Government. It's funded. Initially, it was looking at literacy and numeracy, IT levels in Scotland and probably UK in general. And it was how could you engage with people in work, with employees? It was seen that trade unions would play a key role in that. So that project is funded through Scottish Government, and we've been successful. I think, as the changing room guy says earlier on, we're funded on a 2-year basis. And we continue. We've been successful in that funding for a number of years. So CalMac, I'm sure a lot of people will hear about CalMac, I think, quite regularly on the news through and a lot probably at the moment, which kind of impacts on the employees is quite negative. CalMac's a high-profile company employing 1,900, 2,000 employees. And we deliver lifeline ferry services through the west coast of Scotland. As I say, the current profile, a lot of stuff, we kind of get to that time of year, timetables, cancellations, breakdowns, waiting for ferries to be built. It has a very negative impact on the frontline workers. The maritime industry is historically male dominated, and again historically with a high age profile. That could be 45, 50 upwards. We in the maritime industry usually work 2 weeks on, 2 weeks off. So for 2 weeks of your life, you walk up a gangway, you're on board a ship, and some people look at it as it's like having two families. You walk up that gangway, you work a minimum of 12 hours a day for 2 weeks. You don't just work with people, you live with people. You're accommodated on board the ship. So that is pretty much your new family. With an average crew of 25 to 30 people. As I said, the west coast of Scotland, probably some of the most remote locations, some of the most beautiful places that you'll be for anybody that has travelled the network. But put that with things like lack of connectivity, isolation, basically being on call 24/7 for 2 weeks, and really the problems that come along with that. As I said, isolation is a major factor in the well-being of maritime workers. So for us, we looked early doors at predominantly men's mental health, and what we could do, how we could help. We engaged through the funding that we had. We set out with a target, and I think if you look at every day, look at the statutory, look at first aiders in the workplace. There's a statutory and legal requirement for a first aider in every workplace. That's a given. Not so for mental health first aiders. I think it's something that I think through politically, this is something that has tried to be changed over the years without success. So we set out a target through the funding that we had. We set out with a target to get a mental health first aider in every workplace. It's something that for me and for us with the employer and the trade union, it's still a target that we'll go to. We'll set that target quite high, so we will continue to go with that. We've trained over 100 mental health first aiders in the last few years, and they are in CalMac. We have previously we had a wellbeing action group and a mental health first aid support group, and that covered wellbeing. So we had that support group, and I think as well working through COVID, and through, as I said, through the network, to the geographical kind of spread of people and kind of the remote locations, we would meet up on Teams every 3-4 weeks, or as and when required, and really look at that. So we looked at, when we trained mental health first aiders, what's the next step? What do we do? What do they do? What's their role in the workplace? And it seemed to be something that was quite reactive. As you say, as somebody that's a first aider in the workplace, they're reactive to anything that happens. So we would look to take a proactive approach. So we would look, and through the mental health first aid support group, the wellbeing action group, which latterly turned into a kind of wellbeing committee, we decided that we would invite groups from throughout Scotland to come and meet with us, to come in and probably throughout the CalMac network to see how they could influence what we were doing. So that was groups like Samaritans, another group I think very similar to Andy's Man's Club, is a group called Man on Inverclyde, who came into our groups to see how we could partner with them to support the mental health first aiders throughout probably throughout the network. So that's something that's ongoing. So as I said earlier, the profile, the age profile is quite high. So something that we've been involved in with the employer, and very proactive in the last probably 9-10 years as a modern apprenticeship programme. So we looked at how we could replace the workforce, how we could play our part and bring in young workers, young people throughout the CalMac community to give them a career at sea. So it's been a very, very successful programme. Again, it's probably one of the biggest things for us in recruitment is trying to recruit as many young female workers, and that's been quite problematic over the years. So it is still predominantly male, probably 90% male in the apprentices that we bring into CalMac, into the maritime industry. So we looked at through previous issues that we'd had. We negotiated with the employer to bring the apprentices to college 1 week early. So in that week, we, through the funding that we had and through working with other groups, through Scottish Trade Union Congress, Skills Development Scotland and others, through Glasgow City of Glasgow College, we devised an induction programme. And that induction programme would mean 4 or 5 sessions with the apprentices, 3-hour sessions, and we would bring in specialist providers into the college to work with the apprentices before the college programme started, before they'd even stepped foot on board the ship. And one of the most important things there was a 3-hour session on mental health and well-being, to have that conversation with young people, to prepare them for the life that they were going to. And bear in mind, we were talking about young people who were possibly getting into the world of work for the first time, probably they were going to go through the same, it was going to be the same, it's going to be working away from home, 2 weeks on, 2 weeks off, all these kind of things. So the challenges, as I said, the isolation, everything that went along with it. So mental health and well-being, they were going into well-paid jobs, which for me, saying from a trade union point of view, was quite a good thing. So financial literacy, how to deal with cash, how to deal with our money, social media and cyber security as well. And it's something that's proven for us to have a very negative impact on young people, on young workers and young people in general. And that negative impact in young people's well-being and mental health. So it's something that we brought the induction programme 6 or 7 years ago, and now it's there. It's just a part. It's something, and our work with Skills Development Scotland and Modern Apprentice forums. It's something that's seen as pretty much as a gold standard for young workers before they actually get into that world of work. So it's something that we'll continue to do. And the feedback that we get from the providers that we engage with is that we're taking these young people, these young workers, into a classroom. And one of the most positive things for me is the conversations, the disclosure, the conversations that are had in that classroom. And one of the things for us, for these young workers going forward, is about challenging behaviours, and we work with Show Racism and Red Card as well, about a lot of stuff with diversity and inclusion and loads of stuff. Young people are more likely to challenge things in the workplace, challenge stigma, challenge discrimination. So it's something that as more of these young workers go into the workplace, we have seen these changes taking place. So it's something that it's pretty much a proactive approach. As I say, to mental health and well-being. Other organisations that we work with, as I said, Samaritans, we worked with them, we brought them in, we've engaged with them. We'll look to train the mental health first aiders. We'll look to continually train and upskill the mental health first aiders. Things like conversations with vulnerable people, understanding anxiety and stress. Citizens Advice Bureau, we're looking to work with them on gambling awareness. As I said, young workers, any workers getting into any kind of well-paid job, the stresses of that gambling is a massive issue, and probably for everybody, not just workers. Other things I think that some of the other people have just spoke on is about mental health for line managers, about actually helping to identify issues in the workplace, looking for the signs of people's true mental health, and looking how to be, again, proactive.
Dan, Oh, sorry.
So just to finish, is probably the biggest thing about for working is it's about encouraging conversations. It's for us, it's about breaking down that stigma and discrimination. And when for our workers, our members, for working at sea, and we set that target. If you're working away from home and you're in that isolated environment, if everybody has at least one person that they can talk to and have that conversation with, and we've got people that can listen, then we look at that as being a success, and carrying that forward. So thanks, Bryony. Thanks for the time. Thanks for the opportunity to speak.
Thank you so much. I think it's really useful, especially with apprentices and young workers, that this work's been done and there is a focus on mental health. So thank you so much. We are running just a wee bit over, and I want to make sure that everyone's got time to present. We've got Gary speaking about his experience at Police Scotland. Gary, I know that we've kind of gone through the session. I was wondering if you could focus really on kind of what support Police Scotland gave you and kind of the advice you have for employers, and then we'll move on to Andy's Man Club. We are running a wee bit behind, so yeah, hopefully that'll be fine. So yeah.
Can you hear me okay, Bryony?
Yeah, can hear you okay.
Good morning, ladies and gentlemen. I'm absolutely buzzing and delighted to be here, and I want to thank Bryony for having me on this morning. My name is Gary, and I joined the Scottish Police Service in 1991, and in 2001 I developed a schizophrenic illness, and I lived and worked with that schizophrenic illness for 20 years. So today I'm going to take you on a bit of a journey. There's no slides, I'm just chatting to you. So sit yourself down, buckle yourself in, let's go on a journey. So growing up, I had no mental health issues, symptoms whatsoever. I was a really keen athlete. I did well at school. I got awards. Joined the police like I said in 1991, and joined the regular police service in 1992 and got a top award at the training college. With 5 years service, I was moved into a specialist role, and with 9 years service, I was ready to go for promotion. At that time, I had a beautiful wife, a new house, and a new car. Life was great, happy days. So unfortunately, I witnessed a really tragic event in my personal life when I was 27, and that unfolded at 5 o'clock on the Sunday morning. Now, after that, obviously I didn't sleep that night. I didn't go to my bed. I couldn't sleep. I couldn't eat. And then I'm not being melodramatic here, but one of the worst things I did was I went back to my work at 8 o'clock the next morning. You know, what was I thinking? You're young, you think you're invincible, you think you can cope with everything, so you throw yourself back into that work environment, and that's what I did. Bosses were great, and they were like, Gary, you know, you don't need to be here, you can take your time out if you want. And I'm like, no, I'll be fine. You know what it's like. I'll be fine. And then I worked on a major inquiry in the police in a specialist role for 2 or 3 weeks. And during that 2 or 3 weeks, my colleagues had noticed changes in my personality and my behaviour, and approached me and says, Gary, you need to slow down and you need to take some time out. And I never listened, but I should have, because 2 weeks later, I suffered a nervous breakdown and I was signed off work for 6 weeks with post-traumatic stress disorder. I had good support in the 6 weeks that I was off, from line managers coming to visit me, from colleagues coming to visit me. However, at the end of the 6 weeks, my mental health took a turn for the worst, and I ended up being sectioned under the Mental Health Act and detained in a psychiatric hospital for 4 months. Now, when I first went in, just a personal thing, to the hospital, the first couple of weeks, my wife was taken to one side and told the news that Gary will never work again and you'll never have a family. So that's what she was told. I had no sense of reality. I'd lost it. I don't know if you've seen that film with Russell Crowe called A Beautiful Mind. That's what it was like for me. So unknown to me, when I was in hospital, my wife was getting phone calls every single night when she went home from visiting, from work colleagues, work supervisors, asking how I was doing and stuff like that. And when I was in that hospital, my wife visited me for 6 hours a day, every day for 4 months. The love and support I got for her was unconditional. So as well as the phone calls to my wife, once I've been in hospital for about 3 months, one of my bosses phoned up my wife and says, right, Gary's been in hospital for a few months now. We'd like to go and visit him. And my wife says, I'm really sorry, but Gary's not well enough for visitors. And my boss says, right, well, if we can't help Gary, how can we help you? And my wife said, there's nothing you can do for me. And my boss says, well, if you leave your lawnmower out, I'll cut your grass. If you leave your list of groceries on your doorstep, I'll get the groceries for you. And if there's anything else we can help with, we're always here. So I thought that level of support was pretty significant. And then after the 4 months in hospital, I was finally released from my section and allowed home. And just on a personal note, my diagnosis is called schizoaffective disorder, guys. So for those of you who don't know, that's a mixture of schizophrenia and bipolar. It's got several symptoms, but the main symptoms are paranoia, voices, and dark thoughts and stuff like that. So that's just to give you a flavour of what I suffer from and still do to this day. So moving on from there, from getting out of the hospital, the police were brilliant with me when I got out. There was a forced welfare officer came to see me every 3 weeks. He was a good communicator. He was a good listener. It was good to have him. I quite enjoyed my time with him and speaking and opening up to him. And I was off for 6 months before I was ready to try and go back to work. Also, when I was off that 6 months, my bosses would come and they would take me out for a coffee or a walk. And that sounds really simple, guys, but that was tough because I was off for a mental health condition and I had this preconceived idea that you shouldn't leave the house because you're off sick. My boss is like, Gary, you've not got a broken leg, son. You're struggling here. We need to take you out and go for a walk, go for a coffee, go to the gym. So I had that support from my line manager and some of my colleagues as well. Now, I also had tie-ins with occupational health, who were brilliant with me. I had visits to occupational health 2 or 3 times. And eventually, after 6 months, I was ready to dip my toe in the water with work. Unfortunately, I lost my driving licence. I couldn't drive for a while. So they accommodated me and gave me a job at Dunfermline. So once I was ready to go back, my boss phoned up and says, right, Gary, I believe you're ready to come back to work. And I was like, yes. And he was like, well, we'd like you to come back on a phased return, if that suits you. And I went, a phased return would be great. What hours would you like me to work? And he basically says, you can work any hours that suit you and that'll work for us. Just whatever you want, you say. So I says, well, how about I come in on a Monday, Wednesday and Friday mornings for a few hours a morning? The boss says, if that works for you, that works for us. And that's what I did. So I gradually built my hours up over that 3 months until I was back up to full time. And during that 3 months, I had frequent tie-ins, pretty much most days with one of my line managers who would have me in for a coffee and a chat. And we would just chew the fat, talk about my health, talk about my family and stuff like that. So I had really good support. Having done that for 3 months, I was then made office manager in the CID. Office manager sounds pretty grand, but essentially you're the CID's whipping boy and you do other admin and stuff like that. So I did that for 3 months. And then at the end of that 3 months, I got my licence back. So they gave me a job in Crime Desk. Now, Crime Desk is where you take low-level criminality with no lines of investigation over the phone, and you speak to members of the public over the phone. I did that. There's also another one where you check police reports to make sure all lines of investigation have been completed. I did that job for 2 or 3 years, and the support that I had in that time was fantastic. My line manager would have me in pretty much most days, just checking in with me to see how I was doing, see how I was coping. Occupational health were involved. I had visits to occupational health. And after doing that job for 2 or 3 years, I then moved into the intelligence world. Did that for a few years. Then a job came up as a case coordinator at the Public Protection Unit. Basically, what you're doing, guys, is you're, let me think.
Gary?
Yep.
I don't want to disrupt your flow, but I was wondering if you could speak a little bit about the teaching role that you did and kind of some of the reasonable adjustments that were put in place. Just I'm aware time-wise. I don't want to rush you, but I think that part is really handy.
Right, okay. I'll just touch on one thing before I speak about that, Brian, if that's okay. It was just to say the reason I was telling you about this case coordinator job is, and this is quite important here, guys, it's a good learning tool. Before I got the job there was a meeting, and the meeting was held between a police sergeant, a police inspector, psychologist, a psychiatrist, and a police doctor. And they were having a meeting, and I didn't know about this, but they were having a meeting about my health to determine whether I could carry out the role or not. So I thought that was pretty cool. But they had a meeting there, and the psychiatrist asked the police what they knew about mental health, and they were like, well, not very much. And he says, right, I'll explain mental health to you on a scale of 1 to 12, 1 being the least obtrusive and 12 being the most. And that's what he did, and he talked about mental health and my mental health and stuff like that. And then they gave me a job. So I thought that was quite significant, a good level of support having that meeting. So moving on from there, just to answer Bryony, the one job that I've always wanted to do was become a police instructor at the police college and teach the recruits. But with my mental health, I never thought it would be on the cards. I never thought I would be supported, stuff like that. I got a secondment there for a week and it went very well. I really enjoyed it. And then the big decision came with my wife as to whether or not I would apply for a job with my schizoaffective disorder. And we decided we'd go for it. And I spoke to the bosses at work and they said they would support me. So I put a written application in, got an interview, got a job. And I did that for 3 years and I had blips along the way. And I'm going to talk to you now about how I was supported by the police during that time at the college. So I'd worked there for about 6 months, guys, and I was having a particularly bad day. The voices were quite strong. I was quite emotional. And I just broke down in tears in front of one of my supervisors in his office. And he's like, right, give me a minute, Gary. And the first thing he did was close his door and put the do not disturb sign on. And I'm thinking right away, this guy's taking me seriously here. And then he sat down and he says, right, talk to me. And I just says, look, I'm struggling today. I've got the voices. I've got the tears. I just can't cope. And he's like, right, give me a minute. Let me think about this. And he came back and he says, what I'm going to do, Gary, is I'm going to give you 3 options and you can take whatever one you like. He says, the first option is take some time out and spend time with your family, and I'll think no less of you. The second option, he said, is what are you teaching tomorrow? So I said I was in the morning for 3 hours. And he went, well, I could study the notes and teach that, and you could sit in the back of the classroom tomorrow. Or finally, you could teach, and I'll be sitting in the back to support you. And I chose to go back in the next day, and that's what I did. I went back into class and taught for 3 hours. But it was just, I felt really confident and comfortable because he was sitting in the back, and I knew he was there if I needed him. But the reality is, for the 3 hours I was in there, I didn't really need any assistance whatsoever. So that was one example. Another good example is, again, 6 months later, I was having a bad day. I'd been teaching in the morning, teaching in the afternoon, and I was just mentally burst. Went up the stairs and I'm thinking to myself, you know, my days of teaching at the college are probably over now. And I went and sat down and burst into tears in front of my first line manager. So again, she closed the door, sat down, and she says, right, talk to me. And I says, I'm really, really struggling because I'm teaching in the morning, I'm teaching in the afternoon, and I'm just mentally spent. And she went, well, let's address that, Gary. She says, well, what we'll do is, when do you prefer teaching, morning or afternoon? And I says, well, the morning. And she went, that's fine. I'm in charge of the timetable, so I'll timetable you in the morning to teach. And you could do light admin roles in the afternoon, like checking the probationers' reports or notebooks, stuff like that. So that was a really good adjustment. Another good level of support, guys. I was quite open at work with my mental health. My colleagues kind of looked out for me. And I was having a bad day. I was in class teaching and the symptoms are again quite strong. And I was 45 minutes into a 1.5 hour input when one of my mates knocked on the classroom door and asked for a quick word in private. So I went out and he's like, are you all right today, Gary? And I went, no. And he went, I knew it. I saw you this morning. I thought you never looked yourself. What are you teaching? So I told him what I was teaching. And he went, right, I'll go back into your class for the next 45 minutes and take over the lesson. And you can go back to your room and take time out. And that's what I did. It was brilliant. And one more, Bryony, if that's okay.
Yeah, that's fine. And then we'll, perfect. Yeah, keep going.
The only other one, and this is another good example of maybe having quiet time at your work and having a place for people to go to. So one of my bosses saw I was struggling one day and asked what I was teaching, and I said, I'm not in class, I'm just doing admin work. And he says, if you're really struggling, Gary, go and have some time out in your room and then come back and check in with me afterwards and I'll make sure you're okay. And that's what he did. So that was another one.
Yeah.
And that was it. I had some advice for line managers and stuff, Bryony, but I'm conscious of your time.
Yeah, definitely. I'm conscious of that we've got another speaker as well, but I think that's some really good examples of reasonable adjustments. And what we can do, Gary, because I really like the advice that you've got, if we could have a chat after, or not after, but I'll send you an email and we can get some of that advice like written down as a piece for workplaces to have. Does that sound okay?
Yeah, that's fine.
Thank you, perfect. So thank you so much, and that's some examples of what workplaces can do to put in reasonable adjustments for people so that they can continue to thrive in the workplace and really be comfortable and continue to work and thrive and have safe spaces when they've got mental health concerns and struggles. So thank you so much for that, Gary. That's really insightful. Mark, I'm going to stop sharing my screen. I'm aware we're running over, so if you can share a little bit about kind of the support that Andy's Man Club can support, that'd be great. And I know that you have to head off soon, so just as long as you can, that'd be great.
Yeah, we'll see what we can do. We'll see what we can do. Right, here we go. So there's a small video. It's about 3 minutes long. We're going to fly through this, okay? So Andy's Man Club, peer-to-peer support. It started in 2016. It's named after a lad called Andy Roberts, who sadly took his own life, and this charity came off the back of that.
When I first approached Elaine, it was about finding that one.
Can everyone hear that?
Just getting one man to stop one of the family going through what we've been through. Hi, my name is Luke Ambler. I'm the co-founder of Andy's Man Club, a talking group.
The sound stopped, Mark.
Right.
He were a cheeky chappy, typical lad's lad, tough as nails.
There's subtitles, so we'll
probably had a soft centre. Andrew died early hours of the Tuesday, 5th of April. And the weekend prior to that, he died. An enormous falling out with his partner. And I just think he got himself into a really dark place that he couldn't get out of. And that's the sad thing. We just think he'd have talked to anybody to have snapped him out of it, told him what he were thinking were rubbish, he would still have been here today.
4 days after my brother-in-law, Andrew, died, I approached my partner and asked her about setting up a group where we could get guys just like Andy, myself, talking. 3 months after, I approached my mother-in-law Elaine at a wedding, family wedding, and asked if we could set up this idea where men could just meet up and chat. And together we came up with this concept, Andy's Man Club, a simple idea where men like myself, like any bloke, normal bloke, could just meet and talk. You'll have that anxiety, that nervousness, that fear of judgment, but there's none of that when you come through the door at Andy's Man Club. It's a tea, a coffee, you sit down, a ball gets passed around, you have a chat, and you'll be amazed at what it can do for you, just letting some of that out. A lot more than that now, and we've been on a bus tour, we've met the Royals, we've had letters off Theresa May, you know, Lab Bible, all these cool stuff. Leeds United this week playing against Huddersfield Town wearing the shirts, you know, just reaching the exact demographic that we try to reach. And it's just about finding guys just like Andy, who maybe have got that mask on, who feel like they can't take it off, they're going to be embarrassed or they'll burden someone, just to be comfortable a bit to take that off. And that's what I'm proud of. I'm proud that we have 800 plus guys a week being able to take that mask off and open up and still get to go home with their families on a night.
What we need to do now is to get the whole world to realise that it is okay to talk.
It's okay to talk.
It is okay to talk.
So in that VT there, you heard from Luke, Andrew's brother-in-law, and Elaine, Andy's mum, about Andy and about how this charity actually got off the ground. Simple stat, over 4,500 men take their life every single year. It's 12 men a day, 1 guy every 2 hours in the UK. Globally, it's 1 guy every 40 seconds. That is a scary statistic. Suicide is the biggest killer of men under 54. So you take out any kind of disease, car crash, accidents at work, you're more likely as a man under the age of 54 to take your own life. Following Andrew's suicide, Luke decided to start up a coffee club for like-minded men to come and talk before things got out of control. On the 30th of June 2016, he put a post out on Facebook. Due to the response, the very first group was held on the 2016 and 4th of July. 9 men attended that group, and this Man Club was born. Those 9 men came from Halifax, which is a mining town in England, North Yorkshire. And it was literally guys, normal guys like everyday blokes, come along and getting stuff off their chest. 2 weeks after that, he put out it's the OK to Talk campaign, which is basically take a selfie, doing the OK sign, and pass it on to 5-year mates. It literally went nowhere for 24 hours, and it just didn't get any traction. The problem being is he didn't think it would go anywhere. So he actually got his friends at Leeds Rhinos, where he used to play, to share it. And then it started getting a little bit of traction. And it's now been recognised as the largest mental health campaign on the planet, with over 100 million people taking part. And people like Mr. Ricky Gervais. We all know Ricky Gervais from the show Afterlife. He highlighted the guy's suicidal thoughts and idealisations because he's lost his partner. I'm under no illusion Ricky Gervais knows who Andy's Man Club is. He probably doesn't. More likely he doesn't. But he took part in the campaign, which was amazing. His following then jumped on it and it blew it out of the water. Crack on at 3 of the guys on your screen, which is Anthony Joshua, guy in the middle, Josh Warrington, guy at the end, Kamal Watkins. These are guys that are boxers and rugby players, knock 7 bills of crap at each other for a living. Every one of those guys got involved with Andy's Man Club on all different levels and still are to this day. For them to get involved and help and show their following that it is okay to talk, big boys do cry, men can have emotions, was absolutely phenomenal. This slide here just shows out a varied list of football clubs that are partnered up with us for billboards, for wearing our tops on their warm-up games, for using our logos on their strips, and also giving us space on a Monday night for meetings. The most famous ones recently are Man United and Manchester City, the Etihad and Old Trafford. On a Monday night, the guys go along there and we have our meetings there, and it's phenomenal that these guys are doing that for us. It's basically the demographic we're looking for, men from 18 to 80. Football is played and predominantly watched by men, and again, it's just a great avenue for guys to look at even just look at the logo and go, what is that? I'll go and look that up. And it starts to break the stigma of it at that early stage. This slide here is a bit personal to myself. So I am a grandfather. I have 3 grandchildren, 2 grandsons and a granddaughter. And I do not want my grandsons to use this club, not for suicide prevention. So if you look at every one of those black and white photographs on your screen right now, every one of those kids has got a dad because of Andy's Man Club. I know that's a bit dramatic, but it's the truth. Every one of those kids has got a dad that goes home to him on a Monday night. Phenomenal. The wee guy in the middle, Alfie Roberts. That's Andrew's nephew. And it was told that when Andrew sadly took his own life, when Alfie got told, he let a cry out that could smash windows. No, I never knew Andrew. I obviously joined the charity for my own mental health when 4 years ago, or over 4 years ago. When I got this job as area lead, I had to do this presentation training, and I went down to Halifax. I learned how to do this presentation in the morning, and in the afternoon, I stood in front of Elaine, Andy's mum, Luke, his brother-in-law, Lisa, his sister, and the rest of the staff, and did this presentation, and wee Alfie was in the crowd. Once I finished the presentation, I'm not going to lie, there was tears. I was talking about a son, a brother, uncle, a friend. That wee boy got up, went to the front of the room and did a presentation on how suicide affected him and his family. I was absolutely amazed by it. One day he'll be the CEO of Andy's Man Club. He's now 17 and he's now doing presentations himself on the effects of Andrew's death on him. And he's an absolutely amazing young lad. So I'm going to skip past the 5-year-on video because it's 8 minutes long, and it literally tells us that we started with 1 club in Halifax and we wanted to have 10 clubs in 5 years. By the time we got to our 5-year point, we had 50 clubs nationwide, which is absolutely mind-blowing. Then move on from that to this. As it stands, we now have 230 clubs across England, Scotland and Wales. Open to any man over the age of 18 wanting to talk to like-minded men. We're every Monday except bank holidays, and right now it's English bank holidays. And the only simple reason for that is a lot of our venues are in public buildings. So if the building's closed, then the club's closed. And we have a policy of 1 out, all out. It's not fair that one club can't get support and the rest can. So we just take public holidays off. And what I will say is the guys that run the clubs, the facilitators or volunteers, We'll always do something on that Monday that there's not a club on. Go for a coffee, go for a walk and talk, or just get together. And it really creates that brotherhood. The best about it, it's free in every way, shape and form. You don't have to book. You're not charged for it. There's no referral. It's literally a drop-in. You come along, grab a brew and get involved. Simple as that. And that speaks for itself. I'll put it in perspective for you. When I first joined Andy's Man Club over 4 years ago, we had 700 men walking through our door on a Monday night. Within 4 years, I'm not big on maths, but you can do it yourself. We've gone up 4,300 men in 4 years, which is absolutely insane. We have online, so our online groups run concurrently at the same time as an Andy's Man Club on a Monday night, and it's an absolutely brilliant tool for a few reasons. One, if you've not got an Andy's Man Club in your area, you can use online. If you know someone that's housebound, can't get out, or someone that's just ill, they can use online. If you're just not sure about coming to a meeting on a Monday night, try online. It's one of the best forms if you've not got a club in your area. It's info@andysmanclub.co.uk. The girls at the office will send you out a form. You fill the form in, obviously via email. There's a box on that form to say don't keep my details. We don't take details at Andy's Man Club. So what we'll do is we'll send you the invite out. Once the invite's been accepted, after the meeting goes, we then delete your details. We are a confidential society. We do not take details from anyone. What to expect at an Andy's Man Club meeting? First and foremost, you'll have someone standing outside the building wearing something like what I've got on with the Andy's Man Club logo. He's our sweeper. He's one of the facilitators. He's one of the guys that have come through the door himself, got to a stage where he wants to give back and stepped up into the in-house training to become a member of the facilitating team. His role is to welcome new and old guys to the venue, show them where it is, and introduce them to the other two facilitators in the room. Once the guys come in the door, the other two facilitators will show them the most important part, the brew station. Get a brew, get yourself calmed down, chilled out, and grab a seat. So we have a seat running around in a circle, and we all sit in a circle, and we have what's called the talking ball. And just as that, we prop, there we go. This is the ball we use. We pass this around from person to person. We do have some ground rules for Andy's Man Club, and there's a few things we don't talk about. We have 4 rules in total. We don't talk about medication, politics, religion, and criminal matters. A passing comment on all of these is fine, but we don't go into detail. We have the 5th rule in Scotland, which gets broken quite often. We don't talk about football because you can bring politics and religion into it. It's mainly West Coast, but it has happened. So once you're in the meeting and you're sat down, the other two facilitators have a lead and a co-facilitator. They'll start off the meeting by doing a little introduction. You're going around the room and name it and a reason for being here. At no point do you have to talk. There is absolutely no pressure whatsoever to talk. If you don't want to talk, that ball I showed you a minute ago, you just pass it on to the next guy. Doesn't matter on what question or what part of the meeting. Round the room, introduction, then we go into the meat and bones of the actual meeting. We'll have 3 questions that stay the same every single week. Our first question is, how's your week been? Question 2, one positive from your week. Question 3, anything to get off your chest. These questions are designed to get guys talking and opening up. And again, you don't have to answer any of the questions. We then have about a 15-minute break, and that's where the peer-to-peer support comes in. That's where guys that are basically strangers talk like they've known each other for years. They sit and have a coffee and a brew and a chat, whether it's talking about their mental health or about the TV on last night. It makes no difference. They're communicating, and that's the point of what we're trying to do. We then come back for the last 2 questions, and they're made up by Andy's Man Club, and it could be what is your guilty pleasure song and what you do for your own well-being. Again, you don't have to answer these questions. I'll answer mine now. My guilty pleasure song is Barbie Girl, and what I do for my own well-being is I ride a motorcycle, and that's the truth. But the reason they're designed for that is so that you're not left with someone's trauma. Question 3 can be quite heavy, quite full on with someone's, could be from childhood trauma or PTSD, and they're talking about it, to anything else, getting caught up in the car park. And what we don't want is the guys leaving with someone else's trauma. So we'll add those last 2 questions in, and they change every week. So every week's a different 2 last questions, and something funny, something uplifting, something good and positive, so you're not leaving with trauma. And at the end, we try and use about a 10-minute break at the end just for a bit of peer-to-peer socialisation, so the guys getting to know each other, and it does form a club and then a brotherhood of such, and guys come in week after week after week. So that's pretty much what a meeting does and how it works. I am that one man. So that's one of our slogans that pretty much defines who we are. So I am that one man. Every man on this call is that one man. Believe it or not, every woman on this call is that one man as well. So I came to Andy's Man Club over 4.5 years ago after my last attempt on my life. As I said, I'm Mark. I'm 46 years old. I'm an ex-soldier, ex-construction worker, and like I say, I tried to take my own life, and I got signposted to Andy's Man Club. I didn't go in the first time. I actually drove past on my motorbike and went, nah, no for me. I'm not sitting in a circle and sing Kumbaya. That's no my sort of thing. So when I went home and my wife asked if I went in, I said no. She asked me to go back the next week. So I did. I went back the next week. And all the way over there, I'm thinking, just stay for half an hour, then leave, and say it didn't work. So I got there. I was actually early. Got to the car park, turned my motorbike off, sat up, and there was a guy standing right beside me. Went, all right, is that you for Andy's Man Club? I didn't have a reason to be in that car park on a winter's night at 6:30. So I said yes. I'm not going to lie, I was crapping myself when I walked in that building. I wanted to sign myself in places and what do I sign up for? He's like, no, come with me. And first thing he showed me, the brew station. So I grabbed the coffee and I sat down right beside him. And we cracked on with the meeting. And he went round and he asked him people's introduction, and then he go on to the questions. And question one, how's your week been? Everybody's going round and they're having a bad week and a good week, and they come to me and I went, shite, I don't want to be here, was my answer. Because I didn't. I was still suicidal at that point. He went, right, okay, but you're here now. Question two, one positive, and everybody's going around with their positives. To me, I don't have a positive. I don't want to be here. And the whole room in unison said, your positive is you're here, mate. You've walked through that door. And I was like, wow, brilliant. Question three, anything that got off your chest. And this is what opened my eyes behind Andy's Man Club, I think. This is what made me really sit up and take notice. Every one of those guys was open, honest, and showing vulnerability. There was a guy that had just gone through a divorce. A guy had lost his son 6 years old 6 months ago. And you just kept going around the room, and there's so many guys doing so many different things. And we'll come to a guy just before me. His name was Bill. He's no longer with us. He's an older gentleman. He passed away with a terminal illness. And he was held the ball, and he started talking about his life and his childhood trauma. And when he passed me the ball, my mind's screaming, don't say anything, don't say anything, don't say anything. I was like, oh. I held on that ball for what felt like 15 minutes. It was about 3 seconds and I started talking. And I told that room of 11 perfect strangers my deepest, darkest secrets, which was when I was 10 years old, I was sexually abused by my mum's ex-partner's son. And when I was 17, I was raped just before I joined the army. And I had told no one until I sat in a room of 11 perfect strangers. And I waited for the backlash and for the normal stuff when you tell guys something, like some of the guys already alluded to in previous presentations, the banter that's offensive. And I was waiting for that and I didn't get it. I got empathy. I got support. I got strength. I got love. And I'd never felt that from a peer-to-peer situation, from a male audience, if you like. And it blew me away. I was absolutely blown away by it. I don't remember the last 2 questions, if I'm honest. I don't remember the motorcycle ride home, if I'm honest. But I sat in my kitchen with my wife that Monday night, and I opened up about everything. And Andy's Man Club changed my life that night. It saved my life that night, because if I hadn't, I had a plan. And I thank God I went to Andy's Man Club. So I am that one man. And my story is unique to me, but it's replicated thousands and thousands of times around the UK. Thousands and thousands of men that are needing that support. Thousands and thousands of men that don't know they're that one man. And as somebody else again alluded to it, that I no longer feel alone. And one of the guys said it in his presentation, that's exactly what it is. We are no longer alone. So, moving on, we've had some awards. Andy's Man Club has won. We're one of the last recipients to get the Queen's Award, and we've also won the National Diversity Award. These awards are not for Andy's Man Club. These awards are for the stack of volunteers that open their doors on a Monday night. And you heard Luke talk about the volunteers of 250 heroes that are opening doors on a Monday night. We're now sitting at 2,260 men giving up their time on a Monday night to open the doors, set out the brew station, ask the questions for these guys to come through the door. The best award is and always will be is that one man walking through the door. That's a direct quote from Elaine, and it's 100% true. So this slide here, women in Andy's Man Club. So it says what it does on the tin. Andy's Man Club is a man club. That's what it's for. It's for men to come along and talk. But we do have women in the organisation, starting from Elaine, who's Andy's mum, to Sabrina, the office manager, and admin. All our admin team are women. There's marketing team, most of them are women. These are the cogs in our machine that keep, if like Brian sends an email in, it goes to info at Andy's Man Club, then it comes to through the women at the admin team, comes to me. Or if you want a marketing event, it goes to info, marketing, and it goes wherever it needs to go. As I say, they're our cogs. If I didn't have them, we didn't have half the jobs that I go to. I wouldn't have. We call them our office angels. Oh, and there's Tom. Tom's our resident postman. So he was a volunteer and then he became a facilitator, and he was actually one of the first 9 guys in Andy's Man Club. And he came along and volunteered as a postman, and he's now full-time postmaster at Andy's Man Club, paid position because of the growth of the charity. But on the flip side of this coin, women in general that are helping support their man going to Andy's Man Club, and it could be a mother, a brother, a mother, a sister, an auntie, a granny, a partner, a friend. Any woman that's supporting someone coming along. I'll give you a great example of this. So when I was a facilitator in one of the clubs in Dundee, I was the sweeper. I was the one outside waiting for, just to make sure everybody came in and everybody was fine. I was just about to go into the meeting and a car came around the corner, stopped right suddenly, opened the door and I heard, "You, out." Oh, looked at the car and this guy got out of the car very sheepishly. And then the woman leaned forward, looked at me and said, "What time does this place close?" I said, 9 o'clock. She went, "Fine, I'll be back at 9. Door closed and drove off. And all right. Looked at the guy and went, "You're for Andy's Man Club, mate." He went, "Apparently so." I was like, "I'm on in and I'll show you where it is." And he's now a facilitator in the club. But the fact that she saw in him what he couldn't see, and as blokes, sometimes you can't see what's the end of our bloody noses. She saw he needed the support. She found out where to get the support and she dropped him off at the door. And I used to say this was unique, but it's now happened on countless times across Scotland now. And I'm not sure if it's someone that's actually seen my presentation and listened to me, or it's just happened naturally. But either way, we're still getting guys through the door because the support their partner or the woman in their life's given them. So we'll always give a nod to say thank you for that. And that's what it's all about. Pretty much that's my presentation. Any information you want is www.andysmanclub.co.uk. Any feedback, info@andysmanclub.co.uk.